It's a simple fact of life. Everyone worries, has concerns, gets nervous, and feels certain fears, experiences, and apprehensions at some point in their lives. Often, one or more of these emotions happens on a daily basis. Did you know that to a certain degree, anxiousness is actually healthy? It enables the body to react to certain stimuli and causes us to take action and perform better. As long as the feeling is relative to the situation or problem at hand, it is perfectly normal. However, when anxiety gets severe, chronic, and irrational, you might already have an anxiety disorder and experience episodes of anxiety attacks. This audiobook will teach you how to recognize the symptoms of anxiety so you know how to prepare for it and overcome it. Common symptoms of an anxiety attack include the following: the fear of going crazy. Sometimes, when a person is under tremendous pressure, they may feel as if they are going crazy. This is even more evident during a time of an anxiety attack. If this has ever happened to you, I want to assure you that there is very little possibility that you are really going crazy. You will discover the natural ways you can deal and overcome anxiety attacks. In this video, you will learn valuable information that will help you learn how to recognize the signs and symptoms of anxiety attacks. Dry mouth is another common symptom and is a natural occurrence during an anxiety attack. To counter dry mouth, just sip on water or try a piece of hard candy to stimulate the production of saliva. Shaking and shivering are two necessary functions that your body uses to keep your temperature normal. When body temperature drops from normal, the muscles spasmodically contract, creating friction between muscles and body tissues, thus increasing the body temperature. During anxiety attacks, shaking and shivering is normal. Heart palpitations are also common during an attack. You may feel like your heart is missing beats. This is caused by the release of adrenaline into the bloodstream. This is perfectly normal and can't cause damage to your physical well-being. However, it can cause discomfort and lead to more severe symptoms if you don't learn how to control your attacks. Feeling pain in your neck, shoulders, jaw, mouth, and stomach, as well as having a headache, is also common. When the body is under stress, parts of the body usually get tense, which results in pain. Do your best to try and relax if this occurs. Chest pain is a normal body reaction to an anxiety attack because of muscle tension. Sometimes chest pain is misinterpreted as a heart attack, but it is important to identify from one another, as the latter can be deadly. Shortness of breath is the most distressing symptom of an anxiety attack. It feels like your chest can't expand to take in the necessary air that your body needs. If you experience this, there are 3 important points that you should remind yourself of. You will not suffocate, stop breathing, or pass out. This is a temporary symptom of your anxiety attack. If you experience effects that last well after the attack has passed, it is important to consult a health professional so that you can be sure that there aren't any other underlying conditions that you should be aware of. Understanding anxiety is the first step towards controlling the effect that it has on your life, so do your best to learn everything you can about how it can affect you.
As we discussed in our last chapter, anxiety has signs and symptoms that can be identified and managed once you know what they are. For instance, a panic attack is a sudden surge of overwhelming fear and anxiety that usually occurs without any clear reason and without warning. Most of the time, these attacks are a one-time occurrence, but some people experience recurring episodes. Recurring episodes are often caused by a trigger, like speaking in front of a crowd or doing a presentation at work. Panic attacks may also be a part of another disorder such as depression, panic disorder, or social phobia. These disorders are generally harmless, but people who suffer with them still feel as if their life is out of control. As with anxiety attacks, panic attacks are manageable once you understand the signs and symptoms. A panic attack can happen anytime, but it usually happens when you are away from home. You may be at a store shopping, at work preparing for a presentation, in a class, driving, walking down the street, or even during a sleep. Exhibit these signs and symptoms: increased heartbeat or palpitation, chest pain, hyperventilation or shortness of breath, stomach churning, upset stomach, trembling and shaking, muscle tension, sweating, dizziness and lightheadedness, hot or cold flashes, tingling sensation or numbness, fear of dying, going crazy or losing control, feeling detached from the surroundings. Now let's talk about panic disorder. While most people only experience a panic attack once or twice in their lifetime with no complications or lasting effects, and if you should happen to have more than that, there is no reason that you should be overly concerned. However, if you have experienced several episodes in a short period of time, then you may be at risk of developing a panic disorder. Recurring panic attacks along with persistent anxiety for future attacks and major changes in behavior can be considered a panic disorder. Moving on to phobic avoidance, this occurs when you begin to avoid certain things or situations based on the belief that it will trigger another attack. It can also be avoiding situations that have caused a previous attack. You may also avoid places or situations where escape is difficult and help is unavailable, like riding an elevator or an airplane. Extreme cases of phobic avoidance are a disorder called agoraphobia, which is the fear of being in any situation where you might experience an anxiety or panic attack. Now let's talk about anticipatory anxiety. This is the fear or the fear of having future panic attacks. A person manifesting this symptom is usually extremely tense and over-anxious. When ignored, this condition can be disabling. Then there is the combination of panic disorder with agoraphobia. Agoraphobia is traditionally believed to be a fear of open places or public places. It literally means fear of the marketplace. However, now it is believed that agoraphobia is fear of experiencing a panic attack in a place where help is difficult or where escape would be difficult. People with agoraphobia tend to avoid the following situations or activities: being away from home, driving, confined places where there is a possibility of being trapped, such as elevators, theaters, public transportation, and stores, going out with an unsafe person or someone they aren't comfortable being with, and places where it would be embarrassing to have a panic attack like parties and other social gatherings. In severe cases, people with agoraphobia often see their home as the only safe place. People diagnosed with agoraphobia show different symptoms, but common to all agoraphobics is avoidance, either being in public places or being alone. This is actually a character of phobic avoidance. The difference is that the effects of agoraphobia can significantly limit the person's normal activities. What sets agoraphobia apart from panic disorder is the amount of activities that the person avoids. People with panic disorder stay generally active, although there are specific situations that they tend to avoid. On the other hand, agoraphobics limit their activities because of fearful thoughts. These fearful thoughts can be very damaging to a person's life, as well as relationships with others. Either way, both conditions are the result of panic attacks. Anxiety attacks can be damaging to a person's well-being and can alter the way a person lives. During an anxiety attack, a person thinks, reacts, and behaves abnormally. This happens because the chemicals in the body become unbalanced, which worsen the effects of anxiety even further. As a result, the person feels physical pain, experiences irrational fear, and shows a disproportionate reaction to normal things. Their social life may suffer, including relationships with friends, relatives, family, and even themselves. If the condition isn't addressed and properly treated, the person may think that their life is worthless. In extreme cases, they may commit suicide. Meditation and relaxation techniques are proven effective methods in dealing with anxiety attacks. Through meditation and relaxation techniques such as breathing techniques, the mind will be able to control the body. Meditation and relaxation techniques can be used during an anxiety attack to slow down the heartbeat, control breathing, and divert the mind away from the cause of the anxiety attack. Although these methods require practice, once you learn the proper techniques, they are very effective. The food we eat plays a very large role in our overall health, including our mental health. A well-balanced diet and healthy eating promotes a healthy brain and a healthy body. Natural and organic foods are, of course, a better choice than processed foods or those with preservatives and chemicals. Along with diet, exercise is another important factor, because it helps promote healthy well-being. Studies suggest that as little as 30 minutes of exercise, 3 to 5 times a week, can have great effects on the body as well as the mind. Herbal treatments like St. John's wort, hyperforin, 5-HTP, 5-hydroxytryptophan, Melissa officinalis, ginkgo biloba, passion flower, valerian, skullcap, California poppy, hops, and lavender are used as an alternative to prescription drugs to treat anxiety. These natural herbs can be made into tea, but some are also available over the counter as powder, liquid, capsule, oil, tincture, tablets, and tea. However, a word of warning: don't mix herbal treatments with prescription medications without consulting your doctor first. If you believe in the power of prayer, pray. Many studies show that prayer is an effective way to relieve stress and anxiety because prayers have a soothing and calming effect, both on the body and on the mind. Laugh. Laughter still holds the title as the best medicine. This is because when you laugh, your body releases endorphins or happy chemicals that help you to feel good and happier. Identify where anxiety is coming from. Sometimes anxiety attacks happen for no apparent reason, but that doesn't mean that there is really no reason. After all, something can't happen out of nothing. So if you experience an anxiety attack, there must be a trigger. It might be directly linked to the attack, or it might come from something else, totally apart from the event. Once you identify the cause of the attack, which is as important as recognizing that you are having one, it becomes easier to deal with it directly and process your condition using the natural ways mentioned above or through medication and therapy. A panic attack is a sudden attack of exaggerated anxiety and fear. Often attacks happen without warning and without any apparent reason. As we have discussed before, some people may experience just one episode of a panic attack, while others can have recurring episodes. Recurring episodes usually happen after a person is exposed to various events or situations that may trigger panic. While it is generally harmless, panic attacks can severely disable a person physically, emotionally, and psychologically. In extreme cases, panic attacks can lead to panic disorder. Who gets panic attacks? The condition affects many people. It is believed that 10% of the total population suffer from panic attacks, yet many are still undiagnosed or underdiagnosed. They tend to occur more in young adults. Women are twice as prone to have an attack as men. It is also said that the condition is genetically inherited, so panic attacks may run in the family. How do you know if you are having an attack? A panic attack can be identified by different signs and symptoms. They include increased heartbeat or palpitation, chest pain, hyperventilation or shortness of breath, upset or stomach-churning stomach, trembling and shaking, muscle tension, sweating, dizziness and lightheadedness, hot or cold flashes, tingling sensation or numbness, fear of dying, going crazy or losing control, and feeling detached from the surroundings. What causes a panic attack? Many panic attacks happen without any apparent reason. They just come out of the blue. However, attacks may be caused by past traumatic experiences such as the death of a loved one, family conflicts, bad relationships, divorce of parents, a car accident, or public humiliation. An attack may occur when a person is exposed to various events or situations almost similar to the past that may trigger panic. Stress is closely linked to panic attacks. Triggers include a stressful life event as well as a stressful working or living environment. What should you do during an attack? Panic attacks peak from 5 to 10 minutes and rarely last for more than half an hour. But during this time, you can experience discomfort such as those signs and symptoms mentioned above. Since an increased heart rate is the main reason for experiencing other symptoms, it is important to take control of your breathing during an attack. Breathe slowly and deeply as you can. Breathe in slowly for 3 counts, then hold your breath for the next 3 slow counts. Then exhale for 3 slow counts. Do this until you are calm. If you are able to stand, get up slowly and walk around. It is also helpful to breathe into a plastic or a paper bag. This allows you to rebreathe your carbon dioxide. Carbon dioxide helps correct the blood acid level that had been disturbed by excessive breathing. While practicing deep breathing, try to focus your attention away from the cause of panic. Replace your anxious thoughts with happy ones. If available, do something that will occupy your mind, such as solving puzzles and playing word games.
Panic attacks don't come from out of nowhere, though the possibility of them coming out of the blue can't be discounted. Nonetheless, there is always that something that triggers the occurrence of such attacks. Genetics. Panic attacks run in the family. If your great-grandfather suffered with an anxiety and/or panic disorder, then there is a relative possibility that you might as well. In typical cases, people who have relatives with panic attacks are twice more likely to experience either acute or chronic but intermittent episodes of panic disorder than people who don't. Nonetheless, there are people who have a family history of panic attacks that don't develop the disorder. Medical causes. There are several medical conditions that can lead to the development of panic disorder and panic attacks. Among them are mitral valve prolapse, hypoglycemia, hyperthyroidism, abrupt withdrawal from medication usage, and use of stimulants. Mitral valve prolapse, otherwise known as MVP, is a heart disease that affects the mitral valves, the part of the heart that prevents the backflow of blood. The symptoms of this disease is shortness of breath and chest pain along with others. Not only do these symptoms resemble those of panic attacks, but research by the American Heart Association confirmed that there is a direct link between MVP and panic attacks. Hypoglycemia, on the other hand, is a condition characterized by a lower level of blood glucose. Meanwhile, hyperthyroidism is also a condition that is somehow linked with panic attacks. This condition is caused by the overproduction of thyroid hormones, namely T3 and T4 hormones. Abrupt withdrawal from certain medications is also believed to be a cause of panic attacks, since it may trigger sudden changes in the body. Another factor that may lead to the development of panic attacks is the use of stimulant substances such as beverages with high caffeine content and marijuana. Medications. The body's reaction to foreign materials with medical properties isn't always necessarily positive. There are cases when the substances found in the drugs produce the right conditions in the body conducive to the arousal of panic attacks. For example, methylphenidate, which is more commonly known as Ritalin, is used for patients with ADHD or attention deficit. It is used to treat hyperactivity disorder as well as narcolepsy, which can also cause panic attacks for some people. Gender plays a significant role in panic disorders. According to studies, females are 50% more likely than their male counterparts to develop the disorder. Major life events. Substantial events in life that lead to extreme changes can create the right environments for the occurrence of panic attacks. This may be because such drastic changes create tension in a person's life, upsetting the order of things and forcing the person to confront the changes. If the person fails to respond accordingly, the tension may persist and they might be overcome by it, thus producing a number of symptoms that could be characterized under psychological disorders, panic attacks included. Phobias. Although the statistics are not established yet, it seems clear that people who have severe cases of phobias are more susceptible to developing panic disorders. This could be due to the fact that phobias cause elevated levels of fear to start with. So as you can see, there are many factors that can make people vulnerable to panic attacks, regardless of age, race, or family history. Understanding what may lead to a panic disorder will help you to better understand how to combat the symptoms associated with them.
As we all know, episodes of anxiety attacks can be uncomfortable, unpleasant, and unhealthy. Because of this, most people head to the medicine cabinet for some sort of relief for their symptoms. While some may find medications an effective way to battle anxiety, there are more natural and equally effective ways of dealing with your excessive emotions without subjecting the body to different negative side effects. While all of the techniques that we're going to talk about today are simply a part of living a healthy lifestyle, that doesn't mean that they are easy to incorporate into our busy daily routines. We've actually touched on these subjects before, but they play such a vital role in the fight against anxiety that they are well worth going over again. Let's start off with one of the most important, and that is exercise. Exercise is at the top of the list because it improves the overall health of the body and mind. A mere 30 minutes of exercise 3 to 5 times a week is enough to provide you with a nice amount of anxiety relief. Increasing to at least an hour of aerobic exercise each day will provide you with maximum benefits for relieving stress and anxiety. It doesn't have to be extremely strenuous or all at one time. You can break it up into smaller sessions at different levels of intensity, because exercise is cumulative. So you can start out with a 10-minute workout in the morning and finish off with a 20-minute walk after dinner. Find a way to make it enjoyable and easy to include in your daily routine. Get the right amount of sleep. A popular adage, early to bed and early to rise makes a man healthy, wealthy, and wise, speaks of the importance of sleep in the overall health of a person. It is very important to your overall health to get at least 8 hours of sleep a day. This is a well-proven and effective technique to battle stress as well as ward off anxiety attacks. Eat a healthy diet. Along with exercise and sleep, diet plays an important role in the overall health of the body. Eating healthy foods will help your body chemistry maintain normal hormone levels as well as providing increased resistance to common ailments and illnesses that increase the risk of having an anxiety attack. Avoid unnecessary stress. Most stressors are unavoidable, and it's unhealthy to turn your back on certain situations that need to be addressed. Still, some situations and people cause unnecessary stress that may lead to an anxiety attack. Avoid people that stress you out, learn how to say no, trim down your to-do list, and avoid sensitive topics such as politics and religion, among others. Use relaxation techniques. Yoga, meditation, Tai Chi, progressive muscle relaxation, visualization, and breathing exercises can all reduce anxiety and promote the feeling of relaxation and emotional well-being. Keep a positive outlook on life. While it is very difficult to maintain a good attitude when experiencing an anxiety attack, it is very crucial to be more conscious and help stay in control over the situation to effectively battle your condition. Don't think, "Oh no, not again," or "I can't make it through this" when an episode hits you. Instead, remind yourself that it is only temporary and that it will be over soon. This will help you control your emotions so that your anxiety will not get worse. If these techniques don't work for you, it is probably time to consult a health professional about the problems you are facing. Since the symptoms of anxiety attacks may be a result of other psychological and physical conditions, you need to consult your doctor and get a complete physical in order to rule out any other possible causes. If the anxiety prevails and symptoms last for more than 1 to 2 weeks, especially if you have no idea why, then it is time to seek the help of a trained therapist. A person with a severe anxiety disorder will usually be prescribed medication, therapy, or both. Prescription drugs for anxiety are usually antidepressants and benzodiazepines. However, they provide short-term relief and thus, other therapy is often recommended. Therapy often consists of cognitive behavioral therapy and exposure therapy. They are both effective, especially when combined with medication to treat anxiety disorders. Cognitive behavioral therapy helps patients to replace negative thoughts with positive ones. Exposure therapy, on the other hand, helps treat anxiety attacks by subjecting the patients to control fear in a safe and controlled environment. Through repeated exposure, patients gain greater self-control and more confidence when facing a fearful situation.